So today I'm going to perform a full respiratory assessment on my patient. My name is Michael. I'm a student paramedic from AET. You're Bruce. Can I get your full name and date of birth?
Yeah, sure. So Bruce Singh, date of birth 4th of November 1995.
Okay, Bruce. So in order for me to do this assessment, I will need you to take your shirt off so I can listen to your lung sounds and whatnot. So I won't get you to do that just now. I'll just ask you a few questions first, if that's all right.
Yeah, sweet.
Cool. So by just talking to Bruce, I can tell that there is no immediate distress to his respiratory effort or breathing, no shortness of breath, he's sitting upright, no tripod positioning. So Bruce, do you have any chest pain at all?
No, none.
No? No coughing or anything like that?
No.
Okay. So Bruce, do you have any allergies?
No.
Do you have any new rashes or itching of your skin at all?
Nothing.
No? Nothing new? It's come up? Okay. So do you take any medications?
No.
No salbutamol or Ventolin?
Nah.
Ibuprofen bromide or the Atrovent, the little sprays?
No.
No? Okay. No steroid use or prednisone or anything like that?
No.
Cool. So Bruce, do you have any past medical history? Anything like asthma?
As a kid, but it's gone.
As a kid, but it's gone? Okay. So no history of cord or chronic airway obstruction disease? No heart failure or anything like that? Cool. No infection? No lung cancer?
Nope.
No, okay, cool. No cystic fibrosis?
Nope.
No, that's cool. So just I'm trying to rule out some past medical histories that could relate to a present illness. So Bruce, what was your last oral intake?
This morning, breakfast.
Breakfast, what did you have?
Apple and cereal.
Cool. And how was your last output?
Pretty normal.
Regular?
Yep.
Urination?
Yeah.
Yeah. So Bruce, what were you doing leading up to this just now?
Just coming to uni.
Just going to uni, just walking a little bit?
Yeah, just walking.
Yep. Are you smoking at all?
Nah.
Are you exposed to any environmental conditions? Smoking, like smoke or gases or anything like that on your way to uni? Okay. So now Bruce, I'm just going to start my physical examination. So would I be able to get you to take your shirt off?
Yeah.
That's all right. So with Bruce's shirt off here, I can see that he's well perfused, there's no cyanosis or presenting additional muscle use to his breathing. He's still continuing to sit upright. I can look at his chest and see that there's equal movement. There's no hyperinflation or fixed expansion. I can also see that there's no edema. So Bruce, I'm just going to touch it here. I can press on his chest and see that there's no there's good recoil to the skin. So Bruce, can I just see your hands? Flip them over. So he's peripheral looking perfused as well. No cyanosis, there's no trembling of his hands. So Bruce, I'm just going to take your pulse first, if that's right. So what I do here is I actually count his pulse as well as his breathing, his respiratory rate, for 30 seconds. I will not let him know I'm counting his respiratory rate, just to see that he doesn't change his respiratory rate at all, consciously. So after 30 seconds we can identify that Bruce has a respiratory rate of about 16 breaths per minute, which is within the normal range. It's quite regular. There's no tremors or anything like that in his hands while I was holding it. So Bruce, do you feel, I know you got your shirt off, but do you feel like a sudden onset of coldness or anything like that? No shivering?
No.
So I can look at him and I can tell that he's not shivering as well. So that outrules rigours. I can also see that there's no mottling of his skin, which will also indicate some sort of respiratory compromise. So as well as this, I can also identify that there's no scars on Bruce's chest or back. This would indicate previous medical surgery performed on his chest. That could also indicate some sort of past respiratory system compromise. So next, I just want to listen to your. Sorry, Bruce. Next, I just want to listen to your lungs. It's going to be your throat, chest, and your back as well. So it might be a little bit cold. But can I get you to take a few big deep breaths with me? Again. again. Yep, just going to listen to your throat. Yep, again. And can I get you to spin around for me? Just got to spin you around a bit more. So again, just got to listen to your lung sounds. Very good, Bruce. Could you turn and face me? So, as we're listening to the lung sounds, we're listening for any crackles, wheezing, rhonchi, or stridor. Crackles would indicate some sort of accumulation of fluid within the lungs. Wheezing would indicate some narrowing of the airways, or it might be an indicator of asthma or cord. The rhonchi would indicate some sort of snoring sounds, which would indicate some sort of foreign body obstruction to the lower airways. And the stridor up the top would indicate some sort of upper airway obstruction. From just listening to Bruce, that there is no notable abnormalities. So next we're just going to try palpation. So Bruce, I'm just going to have a feel of your chest as well, if that's all right.
Sure.
So it might be a bit ticklish. So there. Yep. So no pain when I touch you at all?
No.
Can I get you to turn around again for me, please? Yep. Just palpate the back as well. So we're looking for any tenderness, masses. First you can turn back around. Let's say, sorry, we're looking for any lumps, masses, tendernesses, or subcutaneous emphysema, or crepitus. And also we're also looking to confirm symmetrical expansion of the chest. Lastly, we just wanted to listen to the percussion of his lungs. So to do this, we go for the intercostal spaces with our middle finger, and with the other one, opposite hand, we just tap the fingers. I just get you to turn around for me again, Bruce. There you go. So Bruce, you can take your shirt back on if you like.
In summary, with specific regards to Bruce's respiratory system, there are no notable abnormalities, so we can conclude that he is a healthy 20-year-old, but however, in order to gather more information, we could gain a tympanic temperature, SpO2 reading, and an EtCO2 reading using a defibrillator monitor and a tympanic thermometer. This would allow for further identifying of any potential respiratory compromises that may have arisen